Now I'm really pleased to get to introduce Gloria Delgado, who is currently our obstetrics co-chair, and she's going to be moderating the next session. Gloria Delgado was born in Chihuahua, Mexico. She came to the border in 1991 to continue her college education. In 96, she graduated from the University of Texas, El Paso with a Bachelor of Science in Nursing. In 2016, she obtained her Master's of Science in Nursing and Healthcare Systems Management, specialization from Loyola University in New Orleans. From September 2016 until present, Ms. Delgado has been the Assistant Administrator of Women's Services at UT Medical Center of El Paso. And in that role, her duties include management of programs and operations to meet regulatory agency standards for inpatient units to include labor and delivery, mother-baby, and a public health home visitation program called Nurse-Family Partnership. She's an active member of AWAN, American Nurses Association, and Texas Nurses Association. And as her role at TCHMB, she is the current obstetrics co-chair. So I'll turn it over to Gloria to introduce the next session. Thank you so much.
Thank you, Dr. Epps. I will introduce our next speaker, who is Ms. Megan Young. Ms. Megan Young is a manager for HHSC's Medicaid and CHIP Services Division, Program Policy Unit. In that role, Ms. Young supervises a team of policy analysts and subject matter experts who work on maternal and child health policy and programs. Prior to becoming a manager on this team, Ms. Young was the lead subject matter expert for women's health policy in the Medicaid and CHIP Office of Policies. Ms. Young also previously served as the Vice President of the LBJ School of Public Affairs Austin Area Alumni Association. She lives in Austin with her spouse and 3-year-old daughter. Please welcome Ms. Megan Young.
Good afternoon, and thank you, Gloria. So if you would just advance the slide for me, please, Nagla. Ooh. All right, so we don't have a lot of time for this session, and I want to leave as much time to answer your questions as possible. So I'm just going to dive right in. We're going to go with a brief overview of our core Healthy Texas Women program, or HTW. You'll hear me using that acronym throughout this presentation. And then I'll talk about the HW Plus Enhanced Postpartum Services Package. And then I'm going to give a high-level overview of some upcoming changes resulting from House Bill 133 from the regular legislative session last year. Next slide. The Healthy Texas Women program was created in 2016 as a combination of the former Texas Women's Health Program and our expanded primary health program. HTW provides both family planning services as well as other core primary health care services. This program was 100% state funded until early 2020 when we received approval of the HTW Medicaid waiver and began drawing down federal matching funds for the program. Next slide. HTW serves women ages 15 to 44 with incomes at or below 204.2% of the federal poverty level. Women in the program cannot be pregnant, and they may not have other insurance. And there are some parental consent requirements for minors ages 15 to 17. They need to have a parent or legal guardian apply on their behalf. Now, if a woman does become pregnant while she's enrolled in Healthy Texas Women program, she does not need to go fill out a new application for Medicaid for pregnant women. She can report a change to us similar to how she would report an address change online by calling 211 or by mailing or faxing in the change form. And she'll get instructions on how to do that when she's determined to be eligible for HTW. On the next slide. So, and I'm not going to read every word of this. I know you'll have the ability to download the slides, and I think you may have gotten them in advance. So just a high-level overview of some of the covered services in this program. We cover pelvic exams and Pap tests, family planning and contraception services, including LARC, screening and treatment for STIs, and then screening and pharmaceutical treatment or medications for hypertension, diabetes, high cholesterol, and mental health conditions. We also cover immunizations and cervical dysplasia treatment. Next slide. In 2019, the 86th Texas Legislature passed Senate Bill 750, which among many other things in that bill appropriated approximately $13.6 million to create the Healthy Texas Women Plus Enhanced Postpartum Services Package. HHSC contracted with the University of Texas Health Sciences Center at Tyler and UT System Population Health to conduct an evaluation of services used by women in Medicaid for pregnant women in comparison to the HCW program. We also looked at findings from the Maternal Mortality and Morbidity Review Committee to inform the development of the service package. And on September 1st of 2020, we launched HCW Plus Service Package. So these enhanced services are available to eligible women in addition to the regular HCW benefit package that we reviewed on the previous slide. I'm going to talk a little bit on the next slide about eligibility and then circle back to the covered services. So HCW Plus services are for women who are in Healthy Texas Women and who had a baby in the previous 12 months. So any woman who meets the HCW eligibility criteria that I reviewed earlier and had a baby in the past year will be able to get HCW Plus services. Next slide. There's a couple of ways that women can enroll and get into HCW Plus. So first, they can apply for Healthy Texas Women the same way they apply for Medicaid or CHIP, online, by phone, mail, fax, or at a local eligibility office. Women who are eligible for Medicaid due to pregnancy will automatically be tested for HCW coverage before their Medicaid coverage ends. They do not need to fill out another application. Eligible women are enrolled in Healthy Texas Women with no break in coverage. Now, I want to take a minute to note here that, as I'm sure many, if not all of you are aware, that for almost 2 years now, since March of 2020, we have been extending Medicaid eligibility due to the COVID-19 public health emergency. So that means that women are staying on pregnant women's Medicaid beyond that 60-day postpartum period that's traditionally covered. And so these women continue to be enrolled in our STAR Medicaid Managed Care program and have access to the full Medicaid benefit package. So when this continuous eligibility policy that's again temporary due to the public health emergency, when that eligibility policy ends, these women, we will test them for HCW eligibility. They do not need to fill out a new application. And we'll be providing a lot of outreach and guidance to providers, to the women enrolled in our programs, and to our other stakeholders to help make sure that people are keeping an eye out for if we're sending them something in the mail. It could have been multiple years since their eligibility was determined, and we may need to verify some up-to-date information with them if we don't have it in our electronic databases already. So what that means for HCW Plus, though, is that we have a really small number of women who are actually in HCW Plus today because most of the women are staying in the Medicaid program, the larger Medicaid STAR program. So right now, women in HCW Plus would include those women who transitioned from CHIP perinatal coverage and were determined eligible for CHIP for HCW, and women who just went in and filled out an online application or mailed in their application or applied 211 or at an eligibility office. There's a question on that application that asks if they were pregnant in the past 12 months. And if a woman is determined eligible for HCW and she checks that box saying, yes, I had a pregnancy in the last 12 months, then she'll be certified for HCW Plus coverage. So the next slide, please. So once a woman is determined eligible for HCW, we mail her the pink card. So this top image here shows the HCW standard pink card, and the bottom image shows the HCW Plus card. And I think there's a little animation. If you'll just click one more here, a circle should pop up on the slide. There it is. So at the bottom there, you'll see that there's a little indicator there for the HCW Plus. So that's one way that you can verify that if your patients have HCW Plus coverage. You can also do it the same way you would verify their other Medicaid coverage by phone or online. So the HCW coverage period is 12 months. After the first 10 months of coverage, we reach out with any instructions about renewing coverage if we need to collect any additional information to recertify for an additional 12-month period. Women who are renewing coverage after their 12 months of HCW Plus will transition to the core HCW benefit package. Next slide. So as I mentioned before, the HW Plus benefits were designed based on an analysis of services used by pregnant and postpartum women in Medicaid, as well as findings from the Maternal Mortality and Morbidity Review Committee. So these services are aimed at treating the major health conditions that are recognized as contributing to maternal mortality in Texas. So that's mental health conditions, cardiovascular and coronary conditions, and substance use disorders. And these are all outpatient services. Next slide. So this is where you'll go to get more detail on what those covered services are. If you're familiar with our Texas Medicaid Provider Procedures Manual, that if you're using that for your other Medicaid patients, we have a specific Healthy Texas Women Handbook in there that lists the covered procedure codes for Healthy Texas Women, and you can access that at tmhp.com. I'll have another link up on the last slide too that we can leave up while we're answering questions. Next slide. In terms of the pharmacy benefits and the covered drugs, you can view the formulary at txvendordrug.com. And again, I feel like I'm a broken record, but I think it's a really key point that some people miss. So while we have this HCW formulary, it's going to have coverage for certain drugs, like antidepressants, for example, contraceptives, and then the HCW Plus formulary is going to only list those additional drugs like buprenorphine, for example, that is in the HCW Plus formulary, but not the core HCW. But a woman who has that HCW Plus coverage can get drugs off of both formularies. Next slide, please. So if you're already an HCW provider, you can go ahead and deliver HCW Plus services that are within your scope of practice without having to take any additional action with the state. If you want to sign up to be an HCW or HCW Plus provider, the first step is enrolling as a Medicaid provider. During your Medicaid enrollment, or if you're already enrolled in Medicaid and you want to go in and opt in to participate in HCW, you have to just certify your compliance with a state law that says that you don't perform or promote elective abortions or affiliate with an elective abortion provider. And some of the new provider types that were added for HW Plus services are chemical dependency treatment facilities, opioid treatment programs, licensed professional counselors, licensed clinical social workers, psychologists, psychiatrists, and cardiologists. Next slide, please. Okay, so now looking forward a little bit, House Bill 133 from the 87th Legislature regular session last year. I'm sure many of you are aware of it. I'm going to focus just on the two pieces of HB 133 that have an impact on HGW and HGW Plus. So the first piece I'll focus on is that HB 133 directs HHSC to seek federal approval to extend the Medicaid for pregnant women coverage period from the current 60 days to 6 months for women who, after they deliver or experience an involuntary miscarriage. The second piece is that HB 133 directs us to transition HGW from the current fee-for-service model to a managed care model. I have a little more details on the next slide about these changes. So for the postpartum eligibility extension, we are working to prepare an amendment to our Medicaid transformation and quality improvement waiver. That's the waiver that we currently have in place for the STAR program where pregnant women are covered today. Our implementation timing will be dependent on when the waiver amendment is approved by the federal government. We will be issuing public notice and accepting public comment on the waiver application in the next couple of months. Women who do receive the 6 months of extended Medicaid coverage after implementation, we will test them for HGW eligibility at the end of that extended 6 months coverage. An eligible woman will get the HGW Plus services for 6 months for a total of 1 year of enhanced postpartum coverage. And then for the HGW managed care model, we'll also need to seek federal approval. We're doing that through the HGW waiver this time. And we plan to include HGW in our upcoming managed care organization procurement for the STAR and CHIP programs. And the goal there is to promote and ensure continuity of care. As we know, women are transitioning among STAR, CHIP, and HGW based on changes in income, age, pregnancy status. And so by tying those all together in one contract and one procurement, we can help to promote women being able to stay with the same health plan, even if they're transitioning among different programs and coverage packages. So this is a multi-year implementation. Our planned operational start date, meaning when women would begin enrolling in managed care and providers would start submitting claims to the health plans rather than TMHP, is in Q4 of state fiscal year 2024. That's June through August of 2024. And so we'll just go on to the next slide, please. So this is some contact information. I don't know if we want to leave that up or if we want to go highlight our photos for the Q&A here, but just to note that this is an email box where you can reach me and my team here at the state for any questions you have about Healthy Texas Women. We also have the TMHP website here, the HCW specific page. If you go to that website, you can also get the contact information on how to call or email TMHP. They have provider relations specialists who can help with any specific billing questions or help you enroll as an HCW provider. And then we have our patient-facing website, healthytexaswomen.org, that also has a high-level list of covered services, some income eligibility information, and some FAQs that I think is really helpful if you are working to talk to your patients or the community about this program and covered services. Okay.
Okay, Megan, we have a few questions already.
Okay.
Okay, it says, Ms. Young, what diagnosis codes are needed in order to screen for chronic diseases? We find that the labs are not covered if under the preventive medicine codes.
Okay, so that is a really good example of the kind of question to submit to our mailbox or contact TMHP about. We work really closely. We have some nurse policy analysts who work really detailed on the billing codes and diagnosis codes, and I do not. I am not a nurse. I'm not a clinician. So I do know that for the covered services that are covered by HCW and HCW Plus, that all of the billing and reimbursement policy is the same as it is for traditional Medicaid fee-for-service. So for any code that's covered by HCW, any diagnosis restriction, for example, if that is the case, would be the same as it is for the larger Medicaid population.
Okay, May, you already answered this one too, but I'm just going to read it. Is there data on what Medicaid extending coverage during COVID costs, as well as the health benefits to show feasibility for expanded coverage?
I don't have data in front of me on the cost of that continuous eligibility policy. I do know that we have seen a large increase in our program enrollment through this policy as people are staying on who would otherwise not be eligible for Medicaid. And I don't know that we've had enough time. I know that there's some independent researchers who are looking at this, and then we're looking at it a little bit in the state, but I just don't think we've had enough time to pass to really look at any effect on health outcomes. As I'm sure you're aware, that takes a little bit of a longer study period. And this policy isn't in place for about 2 years, but some of the research questions that I'm interested in looking at that I hope we can explore in the coming years are, what is the impact if women are coming back on with a future pregnancy? Is there a better maternal or birth outcome with a subsequent pregnancy for women who did or did not get that extended Medicaid health care coverage?
I have another question from your presentation. How can the public provide feedback or recommendations for HB 133?
Yeah, so there's a couple of mechanisms for that. So first, as I mentioned, we on the waiver amendment specifically, we will post information in the Texas Register when there's a formal public comment period where you can submit comments, ask questions about the waiver applications, where we'll be seeking the federal approval to implement those changes. The other way to weigh in and stay up to date on this is through the State Medicaid Managed Care Advisory Committee. So for Healthy Texas Women Managed Care implementation, we're providing regular updates to that committee's Network Adequacy and Access Care Subcommittee. And I can put a link in the chat, I think, here on how to sign up to track that committee and register to attend their online meetings. They meet quarterly, and we're going to be providing updates about this Healthy Texas Women Managed Care at all of their quarterly meetings.
Okay, there's another question over here. HTW Plus has added some services for mental health, cardiovascular disease, and diabetes management. Many of these services require specialty providers. Have you looked at the specialties provider network available to provide these services, like specialty providers that accept HTW?
Yeah, I don't have data in front of me right now on the number of specialty providers who have signed up to participate at HTW since we've implemented this. I know this isn't a great answer, but we had some technical issues with our system that we use to track HTW provider enrollment, and we've just gotten those resolved recently. But it is something we're actively looking at. I just don't have numbers in front of me right now.
That's okay. Okay. Another question that we have, can you review the differences between current plan and the upcoming managed care model? Can you review that again, please?
Yeah, so right now, Healthy Texas Women is 100% fee for service. So all of the claims would go through the TMHP, the Texas Medicaid and Healthcare Partnership. And then once it transitions into managed care, it'll be really similar if you're familiar with the STAR program that our pregnant and postpartum women are enrolled in today. So the state, will contract with health plans across the state. Then the health plans will actually administer the program. So they'll contract with and reimburse providers, and they'll provide some additional services to their members, such as care coordination for women. We call it special health care needs in our managed care contracts. But for example, like a woman enrolled in Healthy Texas Women who has hypertension or postpartum depression would get some additional support from the health plan in connecting her with specialists, developing a plan of care, and helping her maintain her health. And we also have some family planning specific requirements in Medicaid managed care. I know this is a lot of providers have raised questions about this in some of our previous conversations. So for example, our health plans we prohibit them from requiring a prior authorization for any contraception or family planning service. And women will be allowed to receive family planning and contraception services from providers, regardless of whether that provider is in network or out of network with their health plan.
Okay. Few more questions. Was there a recent change on the age of coverage from 18 to 15? And if so, why was that change done?
No, we haven't made a change in terms of the ages of coverage. The policy around ages 15 to 17-year-olds has been in place since the program started in 2016.
Okay. Next question. Has TXSB 8 affected the requirements to become HTW provider? Since it states provider must attest to not referring for elective terminations.
No, the provider participation criteria has also been in place since the program launched in 2016 and was not affected by Senate Bill 8.
Okay. We have a few more minutes. I don't know if there's any more questions that I can refer to our speaker. I don't know if there's anything else that you would like to clarify from the presentation, or any suggestions of how the public can, because I think this is more directed like to our providers, but how to support our public to be aware of the programs.
Yeah, so the website that we have, healthytexaswomen.org, is more of a public-facing website, and it has a lot of great information on there that I think can be really helpful for folks who are talking with women or community organizations about about this program. That our Find a Doctor page is on that, so you can go look up to see where participating providers are located. We also have some patient flyers that have some program information, as well as information about some of the covered services. Like we have a LARC flyer on there that people can download or order to stock in their offices or something like that.
Very good, thank you. We don't have any further questions, so we will break for a few minutes, and then we'll come back for our next session. I don't know if anything else that you would like to add to conclude the presentation.
No, I'll go ahead and put, that looks like there was another question in the chat. I will go ahead and put the links that I mentioned on how to keep up with our advisory committee in the chat here too.
Very good. So they can see it. Okay, everyone. So we will break for a few minutes, and let me see if they tell me how long it's going to be or break. Give me a second. We'll come back. We'll start again at 1. So we can break for a little bit. And thank you very much, Ms. Young, for your presentation.
Thank you so much for having me.